GETTY STOCKNHS spend over £35,000 a day to send Scots to other parts of the UK for specialist treatment. New figures show the number of patients directed elsewhere has risen by almost 50% over the past 4 years. The NHS National Services Division (NSD), which oversees specialised investigations and the treatment of rare conditions, approved funding for 625 referrals outside Scotland in 201,617, up from 427 in 201,314. Over the period, the total cost of referrals reached £51.7 million, rising from £11.9 million in 201,314 to £15.2 million in 201,617. NSD funds access for Scottish patients to highly specialist services south of the border, with access ensured through a service agreement. Getty Stock. The cost of referrals was £15.2 million in 201,617. We need to know whether the significant rise in patients being sent outside Scotland is a consequence of SNP ministers' failures. Alex Cole-Hamilton, Scottish Lib Dems health spokesman. It also manages a pool of funding on behalf of health boards to pay for individual patient referrals for a prescribed list of services not included in the deal. Lib Dems have called for ministers to explain why there has been such a significant rise in recent years against a backdrop of crippling staff shortages and missed waiting times targets. The party's health spokesman, Alex Cole-Hamilton, said it's important that patients in Scotland have access to the best possible care. If there is expertise elsewhere in the UK that they can benefit from, then it is right that they can do so. However, we need to know whether the significant rise in patients being sent outside Scotland is a consequence of SNP ministers' failures. For example, the failure to plan the NHS workforce properly has led to huge numbers of long-term vacancies. More than 250 consultant posts have been empty for 6 months or more. It is inevitable that patients will have to travel unnecessarily within Scotland and further afield if we don't have the right balance of specialist staffing in each part of the country, as well as repairing the NHS workforce. Concerns about the excessive centralisation of health services demand a better model of health provision that is fit for remote and rural areas. 2. Getty Stock. The NHS National Services Division approved funding for 625 referrals outside Scotland in 201,617. A Scottish Government spokeswoman said NHS funding has increased to a record high under this government, as has staffing, which has increased by more than 12,400. Spending on this very specialist care represents just 0.1% of the record £47.4 billion investment in the NHS over the last 4 years, and a tiny proportion of the total number of procedures carried out in the NHS, which reached a record 1 million inpatient procedures last year. As complexity of healthcare increases and costs rise, it is right that very specialised care for procedures such as lung transplants is occasionally provided at specialist centres out with Scotland to allow expertise to be concentrated and patients and families to be treated in quality settings.